Hi, welcome to PK's classes. Today we will study cardioprotective drugs. Cardioprotective drugs are the drugs which can protect your heart and decrease the risk factors causing cardiovascular diseases. So let us first discuss about the cardiovascular diseases. Cardiovascular diseases, uh, this cardiovascular derived from two words, cardio and vascular. And cardio means your heart and vascular means your blood vessels. So any disease of heart and blood vessels are called cardiovascular diseases. So between heart and blood vessel, the connecting factor is your blood. So any problem in blood also can cause the cardiovascular diseases. So there are many cardiovascular diseases like your hypertension. As we know, the blood pressure is the pressure exerted by blood on the walls of artery, and it is 120 by 80 millimeter of mercury. This is normal, this is systolic, and this is diastolic, systolic blood pressure and diastolic blood pressure. And when it is more than 140 by 90, more than equal to 140 by 90 millimeter of mercury, then it is called hypertension. Then other diseases are there like ischemic heart diseases. So ischemia is a condition in which the blood supply to heart is less than the required amount. So when the so there is a blood supply and there is blood demand by the heart. So if the demand is more and supply is less, then that leads to ischemia. And blood supply if is less, then there will also be less oxygen supply, and that is called your hypoxia. And all these causes the ischemic heart diseases, and ischemic heart diseases include angina pectoris, is chest pain, okay, then myocardial ischemia, then this is due to the disease in coronary artery. So blood supply becomes less because there is blockage in coronary artery. So coronary artery is the artery which supplies blood to heart, and if there is any blockage in the coronary artery, then this occurs. So myocardial ischemia, then there can be cell death called infarction. So myocardial infarction, and this is also called heart attack. And there will be death of some heart cells or myocardial cells. Then we have cardiac arrhythmia. So our heart has a rhythm, and if the rhythm is disturbed, then the rhythm is 72 beats per minute, okay, and if this rhythm is disturbed, then we have cardiac arrhythmia, or if it is associated with pain, we call it dysrhythmia. So this means there is pain associated. Then we have congestive heart failure. So the heart fails to do its work. The work of heart is to pump blood to different parts of the body, and if fails to pump, that means the heart muscles become weak and lost their ability to pump blood, then they lost their ability to contract, then it leads to congestive heart failure. Then there can be problems in blood clotting leading to deep vein thrombosis. So thrombosis is the clot inside the blood vessels, and embolus is the moving clot, and it may lead to pulmonary embolism. So all these diseases, cardiovascular diseases, are caused by some risk factors, and we can call the risk factors. So the risk factors for all the cardiovascular diseases, we can say number one, blood pressure. So if the blood pressure is more, then they can put pressure on the blood vessels in vital organs, which may damage the vital organs also. Okay. And the second risk factor is your cholesterol, and if cholesterol gets deposited in the blood vessels, then that will also hamper the blood flow. Then third one is the platelet aggregation. So again, same platelet aggregation leads to blocking of blood flow in blood vessels. And another risk factor is your homocysteine. Homocysteine is one amino acid, and this amino acid is found in our blood, and we get it from meat. By eating meat, we get homocysteine, and high levels of homocysteine is associated with your cardiovascular diseases. So there is increased risk if high levels of homocysteine are there, and homocysteine, if it is high, then there will be decreased vitamin B6, B12, and folic acid. So if these risk factors are balanced, then we can call as a cardioprotective drug. So cardioprotective drugs include antihypertensives, which reduce the blood pressure, and it may include drugs like diuretics. Diuretics are the drugs which increase the urine volume, so the blood volume decreases and the blood pressure decreases. Then we can have drugs acting on the renin-angiotensin system like ACE inhibitor or angiotensin receptor blockers. Then we can have drugs like beta blocker, rather beta 1 blocker. Beta 1 receptor is present in the heart, and if we say a few examples, beta 1 blocker, atenolol. Diuretics like hydrochlorothiazide, and ACE inhibitors like telmisartan. This is angiotensin receptor blocker like telmisartan, and ACE inhibitor like lisinopril. Okay. Then we can have drugs for cholesterol. For cholesterol, we can use statins. Statins like simvastatin, atorvastatin, and these drugs reduce cholesterol synthesis. Then we can have antiplatelet drugs. To inhibit the platelet aggregation, drugs like aspirin in low dose 75 mg we can use. Then for this increased homocysteine, we can complement it by use of folic acids. So, a cardioprotective kit will contain few antihypertensives, statin, antiplatelet drug and folic acid. So, nowadays we use a term called polypill. Polypill, a pill which contains at least 3 antihypertensive drugs, one statin, one antiplatelet and also contains folic acid. So, this polypill will act as a cardioprotective because it will reduce the risk factors which can cause the cardiovascular diseases. Thank you.